for your cranial nerve exam. Of course I'm right. Well, is it okay if I confirm your personal data first? Just a few tiny questions that wouldn't take too long. Well, your first name. Good. Then your last name. You also have a middle name. Good. Okay. Then what about your date of birth? Right. Good. And then your address. Okay. Good. Now your email address, if I may ask. It's not absolutely necessary, I promise. We're not gonna spam in your yeah. Well, actually, the main reason why we need it is just to be able to send you the results of your tests. That is quite convenient. So, of course, I will let you know about my conclusions right after we do everything. But there might be also some other things that will need longer consideration. Like, I also believe that you're supposed to have your blood test today, and some other tests might also take a little bit longer to be processed. So, yeah. Therefore, it would be really great if we could get your email address so that you don't need to come again just to get your results. Yeah. But then if there is anything alarming there, of course, you'll get your appointment with a doctor. Well, anyway, will you spell it for me? .com. Wonderful. Okay. And finally, your phone number. Yeah, it will be much easier for us to contact you just in case. Again. No, usually we don't flood our patients with messages and stuff, so no, that's totally fine. And once again, is it 8 or 7? Oh. Okay, good. Well, now I'd like to ask you just a few questions about how you've been feeling lately. Well, to start with, you can tell me absolutely anything. It's totally fine. There is nothing unimportant or silly related to your health and well-being. So, whatever you think it might be, some complaints, some symptoms that you've had lately, anything of that kind, I'll be really interested to hear all of that. If you have any kind of concerns, so yeah, just do let me know, please. Well, have you noticed anything weird about your senses? Your sense of smell, maybe taste, your eyesight? Yeah, there are quite a few viruses and some other infections that can influence your senses of smell and taste. I mean, obviously, if you have some kind of a nasal congestion, well, you're not gonna feel that much of a smell, like all the scents around you. And it can also influence your sense of taste as well. They are quite interrelated. What about your eyesight? Have you had any troubles with your vision lately? Do you wear any contact lenses or glasses? I don't see any glasses on you right now, but do you actually? Right. Okay. And then, what about your hearing? Any alarming symptoms? Any clogging? Okay. What about your balance, coordination? Do you ever feel dizzy? Especially when you just... Okay, so when you stand up after sitting or lying for a longer time? Okay, well that might happen. I wouldn't say that it's a big deal, but of course we'll inspect everything today just to see if all the systems function just the way they're supposed to. Well, do you have any questions? I guess that we can begin, and if you have some questions in the process, please don't hesitate to ask me. And also, just in case any of the tasks we do make you feel uncomfortable, or if you feel any kind of pain, discomfort, just do let me know, please. Alright? Well, I'll just add some information regarding your complaints. Okay, well, not complaints really, so just some concern and things that you've mentioned that are related to your health. Do you remember when was the previous cranial nerve exam that you had? Okay, so it seems like you have them quite regularly. Don't skip them. Well, that's really great. Alright, let me take your vitals first. I will just use this beautiful stethoscope. And I guess that you'll have to pull up that shirt just a tiny little bit. Okay, that will do. That's alright. Okay. It's not supposed to be too cold, but it might be a bit uncomfortable, but it won't last long, so sure. Okay, well, if you're ready, good. So I will ask you to breathe in and breathe out really slowly, okay? That's possible. Good. So please breathe in. And now on working just okay, as well as your heart. What about pressure? Have you ever suffered from high blood pressure or low blood pressure? Okay. Well, I suggest that we check it right away. So I'll measure your blood pressure and your pulse as well. Okay, so well, let's put it aside for a moment and let me put this cuff on your arm. Well, you can pull up that sleeve a little bit, but that shouldn't be an obstacle. Okay, good. So yeah, just put your hand in the cuff. Oh, okay, doing good. Doing good. It can be whatever hand you prefer. Doesn't matter. Right. Okay. Good. Ready? Okay, I will just put it this way. Close it. Okay. And now I'll start pumping that air, so it might feel a bit unusual. Okay, so you might feel some tension, like pressure here, but that's gonna be alright. You'll be able to endure it, I promise. Okay, good. So are you ready? I'm starting really slowly. Everything is alright. Your pressure is exactly the way it's supposed to be from what you told me. Yeah, nothing uncommon. Okay, good. So let me help you to take this cuff off. Now you can pull your arm out of this. Good. Can you give me a second? I'll just put it back into the case. Okay, good. Just trying to be organized. You know, it's easier to tidy everything up right away. Just give me a moment. Good. Okay. Well, now, what would you like to start with? We can actually do all these cranial nerves in whatever order. Yeah. Can be fun to, switch it from time to time so that I don't get bored. I'm just kidding. Well, anyway, I guess that we could start with checking your hearing first, okay? Let's start with a very simple test. I will make some snips with my hands, and you will tell me if you can actually hear them first. Later, I will also ask you to count how many snaps you can hear, okay? And then, to make it even more challenging for you, we'll choose different sides and you will have to tell me which side the sound is on, okay? Well, I suppose that shouldn't be too hard to do. Anyway, let's give it a try. So, are you ready? Okay. I will ask you to either close your eyes or you can keep them open, but don't look at my hands because, I want you to perceive the information only through the audio channel without visual hints. Okay, good. Are you ready? So, just let's confirm if you can actually hear the snipping sounds. You can hear them. That's wonderful. Okay. Now I'll ask you to count how many you've heard. 2 or 3. You're not sure. Let's try again. Okay. What about now? And now? Good. What about now? And good. Okay, and what about now? Okay, 3 sounds. Good. Now you're doing great. Now let's try to choose sides. Okay, not really choose them, but I'll pick the side. You will just let me know which one it is, either left or right, okay? You don't have that many options, so yeah. Okay, good. Are you ready? Let's do it. Okay, no need to count them right now, just tell me left or right. Good. Good. The same side again, okay? And okay. Well, good. Now let's make it even more challenging. I believe in you. You can totally do that. You'll have to tell me which side it is, and also count how many snaps you've heard, okay? So, for example, left, 3 snaps, or 2 on the right, okay? You can be as concise as you wish, so just make sure that I understand what you mean, okay? Good. So, ready? Okay. Good. Okay, well, so far so good. Okay, now let me whisper some words for you. Okay? I will start really slowly, then I'll add some more background noise with my hands, just to make it a little bit harder for you, okay? It's not fun when it's way too simple. is it? Well, so if you're ready, good. Orange. Good. Lemon zest. Okay. Then pomegranate. Coconut. Chocolate chip cookie. Okay. Black tea. Coffee with milk. Peanut butter. Toast with jam. 36. 41. 11. 100. 213. 584. Good. Wow. You were quite accurate. It was almost all your answers. Did you have to actually concentrate really hard in order to hear what I was whispering to you? Yeah. Okay. Okay, good. Now, let me inspect your ears a little bit closer. And just have a look at your stethoscope. And now the other one. Okay, now that looks totally good to me. Alright, well, let's do another kind of test. Have you ever had tests with spoon and forks? Shouldn't be too challenging. Okay, I will place this spoon and fork right behind your ear, and it's gonna produce the very peculiar sounds and some vibration, maybe even. So you will let me know when you stop hearing that sound. Okay? Now you don't hear it anymore. Let's try again. Okay. No, hold there, it's alright. Can you still hear it? Are you sure? Okay, got it. Well, let's try with the other one, okay? Well, I have one more tune and fork. It has a bit different frequency, okay? Good. So ready? Good. Does it feel alright? Let me know when you stop hearing, feeling this. Okay. Good. And now let's try once again. How are you feeling? Good. So now, okay. Well, wonderful. Good. So you're doing really great. Well, I suppose that when it comes to your hearing, let's just check one more thing, okay? So just to let me know when the sound changes the side. No need to tell me even if it's right or left. Just tell me when you feel that it changed the side, okay? Good. Okay, well, yeah, you were accurate actually every time. So you were nodding to me when you heard these changes. So that's really good. I didn't even have to tell you that you can use the signal, but it was obvious, I guess. Good job. Okay. Okay, right. Let me just type everything before I forget. How are you feeling? Would you like anything? Maybe like water or something? Are you sure? Okay. No, good. That's fine. Is the temperature here alright for you? Would you like me to turn on the air conditioner? You're good. Okay. Awesome. Okay, wonderful. Well, now I suppose that we could check your vision. Right? Another important thing to do. Okay. Well, I'll use some light just to have a look at your eyes for the start. Okay, could you please look up and look down to the left and to the right, and once again with this side, up and down to the left and to the right. Amazing. Wow, you're doing really great. Now please follow the light for me. Good. Okay. Good job. Just Okay, wonderful. Now let's check your side vision right away. I will ask you to look at my nose. Shouldn't be a problem. And that will be the light coming from different sides. You will simply have to tell me which side it comes from. Okay? Good. From the bottom. Good. Good. Alrighty. Okay, good. have a closer look at your face, okay, for a moment. I will even put my latex gloves on. I might touch your face really slightly, okay? I just need to feel. Okay. Certain muscles on your face. Okay. If I touch this area around your eyes like that, is it okay? No. You feel my both hands symmetrical on your face. Okay. So please keep on looking at my nose and just tell me when you see my fingers wiggle on either side, okay? Maybe on both. Okay, good. Good. Okay, excellent. Keep looking at my nose, please. Don't look at my fingers directly. Okay, wonderful. Now please let me know when my fingers leave your vision. Keep looking at my nose, at my face. Good. Okay, great. Now please let me know when my fingers appear in your field of vision. Good. Okay. Okay, amazing. Well, you're doing great so far. Okay, now regarding your eyesight, let me check a few more things, okay? So, we have to check your vision acuity, and for that, I have a Snellen chart. But what I will ask you to do is to close one of your eyes, okay? Let's start with this one. So now please tell me, could you read the fourth line for me? Good. Good job. Okay. Now let's try the other one. Could you please read the same fourth line for me? It's getting blurry. Okay, let's try again. Can you see me now? So let's give it a shot one more time. Now can you see everything? Okay, then I'm closing your eye. Okay. So it's getting blurry again. Let me have a look at your eye, okay? For one more second. Oops. Let me use the light. Could you please go look up again? And then look down. Come on now, let me. Oh, seems like. Okay, is it alright? Can you please close it just on your own? Okay, let's try to do it this way. So keep on, closing it, but with your hands, okay? And now, so like once again, could you read this fourth line for me? Oh, much better. Good. Good. Okay. Well, now, what is the smallest, the lowest line that you can still see well? What do you think? Let's try. Okay, let's try with that one. Good. Okay. Right, well, you did it really well. Let's try the one beneath, like right under it. Okay. Almost. Almost, yeah. No, you did really well. It's okay. That's alright. Don't worry about it, please. Okay. I'll just take you up for now. And colors. So what color is this? Good. What about this one? Good. Amazing. Ooh. Good job. Wonderful. Okay, let's see what else we've got there. Okay, this one. Now. What about this? Good. About this? Good. Okay. And what about this? Alrighty. And this one? Wonderful. Well, you're not colorblind either. That's great news. Okay. Let's see what else I've got. Have a few more cards for you. So, what can you see here? Okay. So let it be it is. Wonderful. And can you see anything on this one? That's alright. No worries about it. And what about this one? And this. So, once again, let me just clarify. Out of all these blue cards, which one is empty? Which one doesn't have anything inside, any letter or shape or whatever? This one. Good. Oh, you're doing exceptionally well. Alright, I guess that for our eye exam, that's more than enough. That would suffice. Okay. Just give me a moment, please, okay? That's right. Once again, should you need anything like water or whatever you think it might be, just do let me know, okay? Are you feeling good? Feeling comfortable enough in the chair? Okay. No, that looks good to me. Okay, now smell and taste. That's usually pretty much fun. I did it at last. Okay. So what we're gonna do is put some amount of these drops on your tongue. You will let me know if you can feel any flavor. Okay? Shouldn't be too hard. Oops. So, can you feel anything? Take your time. There's no hurry at all. Somebody's a bit clumsy today, I guess. Okay. So, what do you think it is? You're hesitating between vanilla and coconut. Let's try again. No, it's not a big deal at all. Good. So, what does it taste like? Coconut it is. Right, yeah, exactly. Well, yeah, both are quite sweet, right? But coconut has this, yeah, like some notes of flavor that are hard to confuse with anything else. Okay. Now, I guess let's take another one. Well, we have many of them, but usually for the test, we can try 3, sometimes 4, and probably 5 is the biggest amount. Usually there's no need to open your mouth, please. Good. So what I was saying is that usually there is no need in, doing like 10 or more flavors. I can estimate your ability to differentiate between them really easily. Okay, so what do you think it was? Sweet cherry. That's right. Good job. Okay, and now one more. Just to be sure. To be on the safe side. Okay. Ready? Well, whatever it is, seems like you quite like it. Grapes. That's right. Good job. That's a pretty rare one. Like strawberry, for example, and like peppermint stuff. They're pretty common ones. But like grapes and some other fruits might be not as common. So yeah, but you did really well. Good job. Okay, wonderful. Now, I will ask you to take a smell. To give a smell to some testers. pretty easy to recognize, I guess. So, what do you think it is? Rose. Good. Okay. Now let's try another one. Yeah, all the bottles are just black. Not to confuse you with like different colors and stuff. I don't want you to think that like this, to think of them as some kind of hints, right? So banana. That's right. Good job. Well, and okay, let's take this one. Once again, let's take your time. So, chocolate. Good. Amazing. Give me a moment, okay? I'll just add it all in this profile of yours. Good. Well, and finally, let me just check your reflexes. Just relax and listen. So your wrists. Good. Now you need to reflex. Put one hand, not hand, sorry. Put one leg over the other one. Exactly. Good. And now switch them, please. Good. Okay. Now, I will ask you to look at me. Good. So now, would you please smile at me? Good. Now frown at me. Shrug your shoulders, please. Puff your cheeks, please. Good. Now, would you please raise your eyebrows as if you were astonished? Okay. Now, please try to put your head, like your ear, closer to your shoulder. And now with the other side. Okay, well, that's really awesome. And now, would you please give me a high five? And now the other hand. Good job. All right. Please straighten both of your arms, and I need you to close your eyes and reach your nose with your index finger. Good. You're doing great. And now the same thing, but with the other hand. Okay. Wonderful. Good. So, seems like your face movements are alright. Your muscles are working just fine. Your balance, coordination, reflexes, everything is okay. Then, your senses like hearing, eyesight, your senses of smell and taste are good too. Now I'll ask you to close your eyes and let's just check our sensations, tactile I mean. So I might touch you slightly with either side of the brush, the soft like dull one or sharp one, okay? Good. You will just let me know if it's sharp or dull, okay? Good. Good. And what about now? Good. Now once again. And what about now? Okay, wonderful. And finally, what about now? Okay, good. You are doing amazing. Seriously. Let me just type in some of your results into the system, okay? And then I'll send you a very detailed conclusion afterwards, okay? Perfect. Well, thank you so much. It's such a pleasure to work with really disciplined and really obedient patient. So you were following all of my instructions very precisely. Thank you for that. I didn't need to repeat anything twice, so I do appreciate it a lot. Yeah. Well, after a long working day, you start valuing such simple things. Okay, so once again, thanks a lot. Have a wonderful day. Get some good rest. You totally deserve it. And I will see you later for your specialized exams. Yeah, like separate eye exam, hearing test, like all of them will be a bit more extensive. That's the ones we did today. Maybe some extra ones will be added. Yeah, sure. The pleasure is all mine. Thank you. I'll see you soon. Bye. Good. Finally, I can get some rest.